I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. 2024 was a big year for ThedaCare as we continue to carry out our life-inspired vision of creating a healthier future for all. That started in January with the official launch of the combined organization of Froedtert ThedaCare Health. Soon after, we celebrated the completion of the $100 million modernization at ThedaCare Regional Medical Center-Neenah. In addition, we made progress toward opening new medical centers in Fond du Lac and Oshkosh. We also made some exciting leadership announcements. In July, Dr. Imran Andrabi stepped into the role of President and CEO of Froedtert ThedaCare Health, and that same month, Dr. Cavagnol was named President of the Froedtert ThedaCare Health North Region. In today's episode of Health Inspired Talk, we're looking at what the future holds. In our first segment, Dr. Cavagnol joins us to share a little about himself and discuss what lies ahead in 2025 and beyond. To introduce you to our communities, we're going to play a game of Jenga, and we have some questions here that will tell us a little bit about your background. So, what do you say we play?
Sounds like fun.
Okay, why don't you go ahead and pull the first piece?
I'll do it. Okay. There you go.
All right, so these are color coordinated, and we have some questions to correspond with these colors. So, the first one is blue. So, what drew you to military service?
Oh gosh, so I've always felt an obligation to our country. You know, we have so many benefits from living in the United States, and I felt like I needed to give back. My father was a Marine, and so he served, I should say, he would tell you he's still a Marine. He's in his 80s, but he served 3 tours in Vietnam as a Marine, and so I certainly felt a connection to military service. And the only way to serve in the Marines as a physician is to go through the Navy, because the Marines don't have their own doctors, and so that was the best pathway for me.
Okay. All right, why don't you pull our next piece here?
Okay.
All right, our next question here. What led you to become a surgeon?
So I'll back up and say what led me to become a doctor first, okay. Right? So my mom is a nurse. My wife's a nurse, by the way, too. And so, of course, I was molded by nurses. My dad, following his military service, went into pharmacology. And so the conversations at the dinner table were very much focused on medicine. I really enjoy engaging with people. And so that combination of pursuing the sciences and being able to help people, that led me down the path of becoming a physician. Now, a surgeon fits my personality very well. Surgeons get the instant gratification, so I can solve your problem today. And so that, as well as just being able to help as many people as possible, right? And being able to impact patients and their families, that's really what drove me in that direction.
That's a good answer. All right, next piece.
All right, here's a red one.
Okay.
Uh-oh.
Oh.
It's getting a little tipsy.
All right, tell us, what's your secret talent?
My secret talent. So I love to cook on the weekends, and whenever I can, I make meals for my family. I love to experiment with different dishes. It's really a passion of mine. I think if I wasn't a physician, I might have become a chef.
Okay, sounds great. All right, next piece here.
Okay, let's try a green one.
A green one.
See if I can do it without knocking over. All right, showing you my surgical skills here. There you go.
All right, next question for you. Who or what inspires you?
So many people. So I would say, our patients inspire me by overcoming, some of their health challenges, especially patients with chronic diseases and cancer, the commitment they have to trying to maintain, their health and get better. They inspire me. Our team members inspire me. Those folks who are picking up extra shifts and who are working nights and weekends and holidays, so other people can have time off, and their commitment to our mission, they inspire me. And then certainly I've had, mentors throughout the years who I've leaned on for guidance and advice. And so some of those physician leaders and surgical leaders really inspire me.
Okay, why don't you pull another piece here?
Okay, let's go for purple.
Ooh, that's
It's
risky there. Okay, I like it. Okay, social media, yay or nay?
So I am a social media user. I'm not a big Instagram, Facebook guy. I'm on LinkedIn pretty often, and I use it for a few different reasons. One, I want to celebrate the great things that our team is doing, and so I like to highlight the accomplishments of our team. I also, I've committed to our team members that I'm going to be out and visible and in the areas where we're delivering care, and so I want the people who don't get to see me to see, the activity that I'm doing. Lastly, I'm trying to highlight, ThedaCare is a great place to work. So I want other people to look and say, gosh, I want to be part of that. And so those are all the reasons why I'm active on LinkedIn.
All right, why don't you pull our next piece?
Okay.
Okay, there you go. That ended our game for us. So you're out of the woods now for your questions.
Thank you so much. It was fun.
Thank you for being a good sport and playing with us and getting to know you a little bit better.
It was a pleasure.
All right, let's talk high level first. We know social determinants of health are incredibly important in the work that we do. That's the economic and social factors that play into a person's health and well-being. So what are we doing as a system, and how are we addressing social determinants of health?
About 20% of overall health is what we do within the walls of our clinics and hospitals. 40% of overall health is based on the social determinants of health. So what do we mean by that? Food, healthy food, clean water, access to education, income opportunities, those types of things, transportation, safe environments. And so we're focused on overall health, not just healthcare. Traditionally, healthcare is focused on sick care, right? Patients get sick, they get admitted through the emergency department, we take care of them in our hospitals. We need to move upstream and get ahead of some of these disease processes before they even happen. And so that means plugging people into those appropriate community resources that can help them with whatever they're struggling with, food insecurity, housing, things like that. And then on our end, we need to focus on screening and prevention. And so it's getting people mammograms and colonoscopies and other things. It's treating some of those chronic diseases like high blood pressure and diabetes before they get out of control and someone gets sick enough to be admitted to the hospital.
So as part of our Life Inspired movement, we've had different initiatives like Inspired to Fight Hunger, Inspired to Fight for Healthy Housing. Can you talk a little bit about those things and how they really play into our goals as a system?
Yeah, so this is an area that I'm so proud of our team members. Many of them have engaged to help with some of these initiatives. For example, we had many team members go out and help pack food boxes to send out to those who are suffering from food insecurity. Even our senior leadership team engaged with Habitat for Humanity and helped to work on the house that's being built in Neenah for a very deserving family. And I know Habitat for Humanity is also working out in some of our rural communities to expand, affordable housing for deserving families in those communities. And so those are just a couple of the initiatives that we're engaged in. But again, our goal is to work on these social determinants of health because they have such a big impact on overall health, and it's completely aligned with our mission.
Okay. As a system, we embrace technology in so many different aspects. So what are we doing with technology to provide better care for our patients and our communities?
Technology can augment the things that we're doing. It's not going to replace the people, right? Our people are the most important asset that we have. But we're going to use technology so that we can take care of more people. We want to empower our team members so that they can be as effective as they can in their jobs. And so things like leveraging data and analytics, right? Let's not just throw the dart at the dartboard. Let's make a really informed decision based on the data. Robotic surgery, right? That's another example where we've invested in technology, and that means that we can do surgery on patients where they have smaller incisions, less pain, less blood loss, go home sooner, and get back to doing the things that they love to do.
We have some really exciting projects coming up in 2025, 2 new health campuses, one in Fond du Lac and one in Oshkosh. Can you tell us why those projects are important to those communities?
One of our mantras here at ThedaCare is care close to home. In Oshkosh in particular, we were very strategic about where we placed that campus. Most of the residents live on one side of I-41, and almost all of the healthcare assets are on the opposite side. And so we put a facility with an emergency department in the location where most of the residents live, because when you're having a health emergency like a stroke or a heart attack or something else, minutes matter, and we want to make it easy for patients to access us in the emergency department.
Absolutely. And in Fond du Lac, that is a smaller community hospital, and it's providing really important services for, like you said, people who really need them and are saying that we want them.
Absolutely. Over time, as the community continues to grow and we assess what the need is, we'll likely expand the services that we provide there.
Perfect. So let's look beyond 2025 here. We are launching a graduate medical education program within our system. Can you tell us what the GME program, as it's known as, what that is and why it's important to start something like that here?
Yeah, so graduate medical education is the training that physicians need after they graduate from medical school. And so if you want to be a surgeon or an obstetrician or a psychiatrist, you need training in that particular field. We're so excited about this program for many reasons. One is, in some of these specialties, there's not that many physicians, and so it's hard to recruit people to come to the Fox Cities and beyond. And so we're going to have this pipeline of physicians that we train. They're going to be here with their families, and they're going to have spouses who have employment in our community. So that creates the pipeline of new and young physicians who are going to come and serve our community. So that's really exciting. The other thing to know about graduate medical education, just like other education programs, they elevate the level of care that we're able to provide in our facilities. They ask really good questions like, why do you do it that way? And it causes our physicians to sort of pause and think and be able to explain it. And so it really helps us all be at the top of our game when we're providing healthcare to the community.
All right. Thank you so much for being with us, Dr. Cavagnol, and giving us a look into the future.
It was a pleasure. Thanks for having me.
As the new year begins, many people are looking for a fresh start. That can often include seeking new careers. At ThedaCare, we offer a variety of rewarding opportunities throughout locations in Northeast and Central Wisconsin. Kelly Hurt, Senior Vice President of Human Resources, joins us to share what makes ThedaCare a great place to work. Kelly, thanks for being with us.
Thank you.
So what we're going to do is we're going to play this game here. We have some different topics about things that make ThedaCare great, and we're hoping that you can discuss some of those topics for us.
Great. Look forward to it.
Perfect. So why don't you give our wheel a spin?
Okay.
We started on a good one, benefits and perks.
Yeah, so ThedaCare has a lot to offer team members for benefits and perks. In fact, we were named recently as a Platinum Award winner for Employer Friendly in the Fox Valley. So we're very, very proud of that. I think that is a good signal for what we do offer to our team members, and that we don't just try and focus collectively as like our team members as a bigger population, but how do we really narrow that down to each individual person and what matters to them the most?
Okay, perfect. Why don't you give our wheel a spin?
Okay.
Okay, this one is support for nurses who play such an important role within our organization.
They do. One thing that we definitely like to do, especially for our new grad nurses, is that we bring them into a residency program so that they're able to transition better from that clinical academic space and over into a taking direct care of patients space. And we really want to make sure that we focus on all the skills, not just necessarily the clinical skills, but some of the soft skills, so that we can help better prepare those nurses for coming into the workplace.
Oh, that's wonderful. Okay, next one. Okay, career advancement.
Career advancement is also a major focus of ThedaCare. Part of our actual strategic plan for human resources is to make sure that we focus on the things that are going to align with what a team member is looking for to grow and develop their own skill set. And so it can be things like succession planning. It can also be things just to give them, the development to better their skill set as a leader. And make sure that we as an organization are supplying them with those opportunities to grow and develop if that's what they're looking for their career.
That's great.
Yeah.
All right. How about you spin again? All right. Innovative pathways.
One thing that in particular that stands out to me here is with our APC group, Advanced Practice Clinicians. So some organizations will call them Advanced Practice Providers. It is our group of nurse practitioners and physician assistants. And so we really worked hard to develop a program that is a fellowship for APCs that helps bridge that space between coming out of school and taking on a clinical practice. And that, again, it all just goes back to how can we help them feel like they've built a skill set that isn't just academic driven, but is a skill set that is actually hands-on and make them feel more prepared to take care of patients.
Okay. Do you want to spin again? All right, investing in team members.
Yeah, so investing in our team members has been a very important component of our overall human resources strategy. And one element of that strategy is around making sure that we are always fair and competitive on wages. So over the last 3 years, we have invested probably close to $80 million in wages for our team members to make sure that we maintain a position of being competitive in this market. And then newly released information is that ThedaCare is moving minimum wage to $16.50, which is really important for our very critical entry-level positions that we always need to be able to fill and retain. And we feel like from a market competitive standpoint, this was a really critical decision for us to make. And so we're pleased to have recently announced that to the ThedaCare team that we are increasing that.
Okay, Kelly, we're all done with our board. I think we've hit all of our topics here. So if people want to get started and explore our opportunities, how can they do that?
So the best thing to do is to go to ThedaCare.org/careers. That takes you to our careers page, and you'll be able to explore all the opportunities currently available with ThedaCare. You know, I always tell everybody it takes a city to run a health system. So it's not just clinical positions. We have a lot of business support positions, the things that a lot of people don't tend to think about when they think healthcare, but very, very necessary positions for our organization.
Absolutely. Thank you so much for being with us.
Absolutely. Thank you.
And no matter your goal for the new year, we wish you well into the journey to success. Watch for exciting news coming soon on the opening of ThedaCare Medical Center Fond du Lac. Follow us on social media and visit ThedaCare.org to stay up to date on the latest. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.